Hey, what's up? Zach here. And Rafa Nadal's recent victory at the Australian Open has been reverberating around the sports and medical worlds, both for the amazing feat of winning 21 Grand Slams and separating himself from Federer and Djokovic in the greatest male player of all time debate, but also for just getting to the end of a 2-week tennis tournament in a best-of-5 set format after just months ago going through a major flare-up of a foot condition that has the potential to disintegrate the bones right from underneath of you. So how did he do it? So back in the summer of 2021, when I made the first video actually just explaining his condition, Muller-Weiss, I said the most important thing was the time off of his foot. So I think number one, the most impressive thing about his recovery was the timing of it. He took about the shortest amount of time that you could off your foot with this injury, which was around 5 months total. Because remember, Rafa Nadal's foot condition, Muller-Weiss Syndrome, is a developmental disorder where the keystone bone of your arch, the navicular, begins to literally disintegrate underneath of you due to a defect in that bone's blood supply, which begins around the age of 2 to 3 years old. And this disorder can, in theory, flare up at any time. However, in Nadal's case, he's been dealing with this all the way since he was a kid, so this is not the first time this bone has actually done this to him. However, anybody that's over the age of 30 knows recovering from something when you're a teenager in your early 20s versus recovering from something in your mid to late 30s is a completely different story. And when I first made my video explaining Rafa's foot condition, Muller-Weiss, even I was skeptical that he could return to the tour in the same real dominant fashion he had been used to in the last decade, because his game is just so dependent on his feet. But for Rafa to come back at the beginning of this year in really any meaningful way after that false start during the summer hardcourt swing last year in 2021 in North America, Rafa had to do a few things. Now, number one, and really most important, was for him to just get off of his foot, which if you saw some pictures of him playing golf and doing some other events, I'm not so sure he was listening to his doctors as much as he could have been during those times. But the second most important thing Rafa had to do, besides just resting his foot and letting the bone consolidate, was he had to start getting as much blood flow to his foot, specifically the midfoot bones, as humanly possible. Now, to accomplish this without having to have surgery, there are a few ways you can get this done. Number one, it did appear that he did have a biologic injection performed, and there actually were pictures of him coming out of the clinic when he was on the crutches. Now, some say that he was there to have surgery. However, right after this, his team really refuted this, saying that he was just getting a medical treatment. And now there are a couple big differences between just a treatment, which is more non-invasive, versus open surgery. Typically, that's just done with an injectable needle under live x-ray view. You find the bone you want, you get the needle right in the area, and you inject it. But after there is some evidence that healing has taken place, that's typically when they're going to want you to start moving that body part, getting things strengthened up, and start getting yourself on the road to recovery where that bone can actually take the pressures of, say, professional tennis. And also, I hear a lot of people talk about biologic injections like it's just one thing. However, a biologic injection can mean a whole host of different things that you're injecting into the body, all with different aims and goals depending on what is going on with the body. However, it's usually up to the doctor or team of doctors to decide what is the most important thing they need to get into the area that's in question. In Nadal's case, his navicular bone and destructive bone. So it's usually going to be something that's going to try to build up a scaffold of bone, and then something that's going to stimulate the body into building new bone, or at least getting more blood flow into that bone. Now remember, non-invasive biologic injections are not the be-all end-all of healing, and there are studies on both sides of this issue claiming that number one, there are significant benefits to healing, and number two, other studies saying that there are absolutely no benefits at all with injectable therapy. However, if you have the resources to try them, in my opinion, if it saves you from having surgery and allows you to keep competing, then I think it's definitely worth trying. Now, the next step in Rafa's accelerated recovery is getting all of the muscles around that bone as strong as possible so they can take as much pressure and load off that bone as possible. Now, that means a lot of non-weight bearing strengthening and range of motion exercises, both to the foot and lower leg. Now, this will increase the strength of the foot, but more importantly, it'll increase the blood flow around that bone, serving two pretty darn important purposes. And I would assume that Nadal did use some form of bone stimulation, which was they put a device around the foot or any other bone that needs help healing. And what that does is creates an electromagnetic field through that bone. It creates a positive and negative charge on both ends of that bone and kind of helps to pull it together. Now, I don't really have any evidence that he actually did this, any hard evidence that is. However, I would assume his team at least considered this as part of his treatment plan. And once all these steps are taken, at that point you can start to take follow-up x-rays and CT scans and to see if that bone is actually melding together. And if it is, which in Nadal's case, obviously that's what did happen, that's when you can start stepping foot on court. And that's where the third step comes in, which is his footwear choices. And the funny thing is, I actually made a video about his shoes at the end of the summer 2021 hardcourt season because they were a little bit different than the normal Vapor Cage 3 hybrids that he's been wearing for the last few years. However, once he got to Australia, he was right back to those old Vapor Cage 3 hybrids, and I would assume after he started getting on court and kind of assessing his foot, I'm sure his doctors did make him a pretty stiff insert from the bottom of his foot so that you could kind of bypass some of the shock to that bone. And I also would assume that if Nike's making him custom shoes, they more than likely stiffened up the midsole of his shoe to take even more pressure off the bottom of that foot. And speaking of the bottom of the foot, the funny part is when I was first putting this video together in the beginning of 2022, when I started hearing Rafa was starting to practice again and coming back on tour, I thought, you know what, it would probably be really smart for him to come back at the clay season and grass season, because that's really when they're going to play on the most soft surfaces, be the easiest for his foot. But in typical Rafa fashion, he decided to come back on the most unforgiving hardcourt possible, a outdoor hardcourt in the middle of a brutal Australian summer. But in all seriousness, I think the most important aspect in his ability to recover from this in such a short amount of time, number one, is his just overall conditioning and health prior to this injury. Remember, Rafa is one of the most well-tuned athletes in the world, and he understands how to get the absolute most out of his body, even if he is not really feeling 100% physically. And also, he just had a lot of luck on his side. Remember, sometimes no matter what you do and how much you rehab, these destructive bone disorders like a Muller-Weiss can still take you out. But you know what they say about luck, the more you practice, the luckier you get. But I think the more interesting question is, was this Australian Open win for him just a one-off? Was he just channeling all the emotional, mental, and physical strength he could and just kind of bringing it all together and just trying to get this one Grand Slam done, and after this he's just going to kind of break down? Well, I'm not so sure. I mean, Rafa Nadal is not someone like Pete Sampras or Roger Federer. Remember, Sampras and Federer were able to kind of continue to win late in their career because they were able to shorten points so quickly, right? To get to the net or hit a winner. Whereas in Nadal's case, he's still playing these ridiculous rallies. He's still playing 20 feet behind the baseline. He's still going back and forth and retrieving balls. So he's still using all the physical skills that he had back when he was a teenager in his 20s, still now to win Grand Slams. And if he could do that in Australia now on a bum foot, I mean, imagine what he's going to be able to do on a softer court like clay or even grass. But of course, love to hear your opinion. How many Grand Slams do you think Rafa is going to be able to get to? Let me know in the comments down below. And if you want to take a deeper dive into the history of Rafa's foot condition, Muller-Weiss syndrome, then make sure you click into this video up above and subscribe down below. Respect your rubber and foam, and I guess Grand Slam title records. I'll see you in the next video.